This is the time in our assembly when we like to reflect on the inspiring stories and comments from our patients about how you have touched their lives and their hearts and how you make a difference for each and every one of them. While we received numerous cards, letters, phone calls, all sharing their appreciation for you and all that you do each and every day, today we have a grateful patient who would like to share his sharp experience story with all of you. And what a story it truly is. So please welcome an extraordinary man who is indeed a physician who has been practicing at our organization for 10 years. He has 3 above average children and has been married to his wonderful wife for 15 years. He is a joke maker and an avid Pittsburgh sports fan. So without further ado, please welcome the amazing Dr. Bijal Patel.
Thank you, Dan. Thank you. Oh, what a staff meeting. Thank you for having me here today. This is my story. On Monday, January 7th, 2013, I was seeing patients and started to have flu-like symptoms. I spent the night fielding many pages and phone calls about sick patients. I drove in the next morning with multiple layers of clothing, heat on full blast, with my teeth chattering. I was trying to find the strength to see my patients when one of the doctors convinced me to cancel my clinic as my patients don't want to get sick either. I went home to rest. I started having fevers, diarrhea, headache. The next day, I again canceled my patients. I had never called in sick before. That evening, my wife told me I need to see a doctor. I am a doctor. The next day, I continued to have fevers. I felt off balance, and I couldn't even walk without holding on to the walls. That night, my wife found me sitting on the floor of my shower. I was so weak. "What do you think you're doing?" "I have to see some patients. I've canceled so many. I can't let them down." She told me she was calling 911. As confused as I was, I told her to take me to Sharp Memorial, where I had been working there for the prior 6 years. In the ER, a bunch of blood tests, a CAT scan, a spinal tap were done. I had poor kidney function, viral meningitis, and signs of severe inflammation, but no exact diagnosis. That night was kind of a blur. Within a few hours, Friday morning arrived now. I was on call for the weekend. I texted my partners. Fortunately or unfortunately, I've been admitted to 5 West with a sodium of 123, a creatinine of 2.9, and a C-reactive protein of 457. I don't think I'll be able to work this weekend. Sorry for the late notice. My partner quickly ran to my bedside and transferred me to the ICU. That day, I did my best to die. My heart had signs of damage with ST elevation on the monitor, troponin of 6, an echocardiogram showing spiraling systolic function. My temperature would not go below 104. My blood pressure kept dropping. More and more doctors kept on visiting me, trying to secure a diagnosis. I got ultrasounds, CAT scans, MRIs. By early Saturday morning, there was an extreme sense of urgency as all the doctors gathered around with my wife to tell them how bad I was doing. My partner figuratively slapped me in the face and told me, "Bijal, you're dying even with all our treatments. Your kidneys aren't working, your heart is failing, and I think we need to open up your leg to see if there's an infection." The anesthesiologist came to my side and told me I was going to die without the surgery. And he told me that I had a high chance of dying on the table with surgery. I was crying. It was the first time I actually grasped what had been happening to me. I begged him, "Please don't let me die." My parents arrived later that day from Pittsburgh, and they saw me for the first time in months. I was on the ventilator with multiple tubes and lines. It's still hard for me to think about what they must have been feeling at that moment. After 3 surgeries, 4 days on a ventilator, I woke up from a medically induced coma and remember thinking, I am alive. I was diagnosed with strep toxic shock syndrome, with myositis, necrotizing fasciitis. Most people die with this illness, and many don't know the diagnosis until it's too late. It's so rare that most doctors don't recognize it. The few that live lose limbs. I spent a total of 20 days in the hospital. It was 3 months before I could walk again, and 1 year before I actually came back to work full time. Relationships saved my life. Each and every person I came across during my illness was equally important in getting me better, and for that I am grateful. Thank you to the ICU nurses who cared for me tirelessly, knowing my every desire when I couldn't speak. The doctors who acted upon their duty and oath. They worked day and night collaborating with each other, making sure I never took my last breath. The floor nurses who became my family, holding my hand through the toughest times, making sure I was comfortable. Thank you to the nurse's aide who used 12 razors to shave my ferocious beard after 1 week in the ICU. I'm Indian. Thank you to dietary services who made ordering food something to look forward to. Angelina. Offering a glimpse of some control in the craziness. Thank you to the concierges who welcomed my family to a place they did not want to be. The physical therapists who strengthened my limp body, hold me up when I couldn't even stand on my own 2 feet. The Arts for Healing program who Reiki'd my headache away and let me create bedazzled picture frames when my kids couldn't see me. Thank you to the transporter whose whistling on my way to radiology made my pain a little less. The janitors who made sure I slept in a clean room every day and asked me how I was doing. The chaplain, my colleagues, my friends, and my family who helped recruit a higher power. Relationships eased my fears. What I'm most grateful for is how each person took care of my family when I couldn't. You comforted my wife with eye contact and constant updates. My parents were in awe of the buzz of my care team, working so hard to beat the odds I was given. My 2 brothers, a doctor, a pharmacist, and my sister-in-law, a nurse, were treated as an active part of my care team, yet were spared the burden of choice in my treatments. You supported them by listening, handing out hugs, and shedding some tears. How can I repay you? As a patient, every second of every hour of every day, I carried the fear of the unknown. Would I lose everything I worked for? That is debilitating. That is scary. Relationships strengthened my will. As I recovered over 3.5 years, you helped me find my strength. I caught a difficult glimpse of chronic illness. I don't know how our patients do it. You were my cheerleaders, you were my coaches, and you will always be my heroes. It was only when I came back to work when my recovery advanced. Perspective is an amazing gift. I felt lucky to be able to take call again. It made me feel whole again. That went away quick, but anyway. We know how difficult it is taking care of people. Many of our patients have a fraction of what we have, and some have no one else in their life but us. Caring for patients is a complex task requiring diligence, coordination, and communication, and we do it with pride, grace, and kindness. As you are daring greatly, never forget how significant you are in the life of our patients and those who work by our sides every day. Each action you take creates many ripples which can inspire or destroy the will of a patient or even your colleague. Let's make sure we are cohesive, collaborative, and supportive of each other. How else can we fulfill our mission? Caring for people who are ill and in dire need is one of life's greatest privileges. Create situations which are mutually beneficial. Learn about your patients' lives, their family, their wishes. Building their story makes your encounters more effective, more honest, more rewarding. With so many forces pulling at us, there will be times when we will struggle with our work. We can find comfort in spending a few more minutes, reducing the fear of the patient, updating the family with an extra phone call, or even asking a coworker, "How are you feeling?" Experience this difference. Giving, sharing, and treating others with respect and kindness better serves our purpose, and it increases our resilience. It is a powerful cure to our own struggles. Today, I ask you to remember to be kind to yourself. Each time we see a patient, it does take a little piece of us. Remember, the opposite of self-care is self-neglect. Make time for yourself. Hike a mountain, learn an instrument, take your birthday off, get a massage, prioritize sleep. As givers, we need to learn how to take. We need to be aware of compassion fatigue and how it can hinder our mission. Don't be afraid to speak up. Don't be afraid to recruit help. Sometimes we need help. We sure as heck deserve it. The health of our society depends on us. As our task may become more difficult, we must continue to fight for the health of our patients and ourselves. I live to tell you to keep on listening, keep on caring, and keep on connecting. Connections give us hope, comfort, and joy. Connect with your neighbor, connect with your colleague, connect with your primary care doctor, connect with your patient. And remember, never underestimate your power in making someone feel significant. It will save a life. It can give someone new life. It may one day even save your life. Thank you for allowing me to share my story, yet I truly believe this is our story. As a patient, as a doctor, and as a fellow human being, I honor you. Thank you.
Thank you so much. You're awesome.